Hello, I am Caitlin Broniker, and I chose to do my PowerPoint over MRSA, methicillin-resistant Staphylococcus aureus. I chose this topic because I see MRSA a lot in the med-surg setting in the hospital. I really just wanted to get a better idea of what it was, how it is spread, who is at risk, and how I can prevent it. I tend to have quite a few patients with a diagnosis of MRSA. Staph can enter the body through a cut, scrape, or rash. It can cause minor skin infections. Most of these heal on their own if the wound is kept clean and bandaged, but sometimes antibiotics are needed. MRSA is different from other staph bacteria because it is resistant to many antibiotics that treat other staph infections. MRSA becomes resistant by changing in ways that affect the ability of antibiotics to do its job. MRSA is a type of staph. It is a bacterial infection that is resistant to many antibiotics. Most people have staph living harmlessly in their nose or on their skin. Many strains of staph are common. Bacterial changes leading to resistance can be caused by the improper use of antibiotics, like taking antibiotics for things that cannot be cured, such as a virus, or not taking all of an antibiotic when prescribed, taking individuals' antibiotics that were not prescribed to the individual. MRSA can cause many problems and could lead to severe problems such as bloodstream infections, pneumonia, surgical site infections, and if MRSA is left untreated, it could be led to sepsis or death. Can MRSA be spread from person to person? Yes. It is spread from direct contact with an infected individual. It could be spread by an infected wound or contaminated hands. Even if individuals do not have any signs of this infection, they can still spread the bacteria to others. What does MRSA skin infection look like? Typically, it's a bump, boil, pustule, or infected area that is red and swollen, or full of pus. It may be painful and warm to the touch and accompanied by a fever. Sometimes MRSA lesions are mistaken for spider bites. There are two types of infections: hospital-associated and community-associated. Healthcare facilities like nursing homes, hospital, and rehab, and individuals with a weakened immune system are more at risk. Community acquired could be groups of kids that spend a lot of time with each other in close quarters, such as athletes, where common sports are wrestling and football. Things that are close skin-to-skin contact, like camps, schools, and dorms. Sometimes people can be carriers of MRSA. Bacteria can stay on or in individuals' bodies for days, weeks, or even years. They can spread it to others even if their skin looks normal. That's why washing hands well and often is so important. Studies show that about 1 in 3 people carry staph in their nose. Usually no illnesses will occur. 2 in 100 people carry MRSA. Severe cases of MRSA in the United States are trending down. MRSA is tough to treat at times. It is resistant to first-line antibiotics. There are limited treatment options when it comes to treating MRSA. If a wound of any kind seems to be infected, seek medical attention. Vancomycin is the drug of choice for critically ill patients with MRSA infections. Doctors diagnose MRSA by checking a tissue sample or nasal secretions for signs of drug-resistant bacteria. This sample is sent to a lab where it's placed in a dish of nutrients that encourage bacterial growth, which is called a culture. Preventing MRSA. To prevent MRSA, good hand hygiene, especially in healthcare facilities, washing hands before and after entering the room are important. Keep scrapes and cuts clean and covered with a bandage. Avoid contact with other individuals, wounds, and their bandages. Avoid sharing personal items such as towels, washcloths, razors, and clothes. When washing clothes, wash with hot water and bleach and then dry in a hot dryer to kill bacteria. Considerations: African Americans have an increased risk of acquiring community-associated methicillin-resistant MRSA. Infections compared to Caucasians is more common in certain ethnic groups. Family members and friends may be uncomfortable going in a hospital room wearing a gown and gloves to visit a loved one, as well as the patient being uncomfortable with the feeling of being in isolation. The patient misses out on the relationship and connection to these visitors because the visitor is uncomfortable with the infection control procedure that requires the wearing of a gown and glove. Microscopically, S. aureus is a gram-positive organism characterized by individual cocci measuring 0.5 to 0.7 in diameter. The organisms can occur singly, in pairs, or in short chains with a strong tendency to form clusters. Cost in healthcare is estimated excess cost related to antibiotic resistance range from $100 million to $30 billion annually in U.S. hospitals. Infection control methods have proved cost effectiveness when rates of colonization infection are significant. MRSA is relevant to my current nursing practice because I work on a med-surg unit in a hospital. I have several patients with a diagnosis of MRSA, whether it's in the nares, in a wound, or in their bloodstream. It is a very common bacterial infection in the hospital. Healthcare providers always start the patient on vancomycin IV to treat this bacterial infection. This is one diagnosis that I am familiar with and see a lot of, but wanted to know the pathophysiology behind it.